Hello, I'm Dr. Beena Muktesh, Clinical Director, Cloud9 Fertility and Silverleaf Fertility Center, Gurgaon. I'm going to discuss the process of IVF in a very simplified way. Every eighth couple who tries to conceive finds it difficult to get pregnant. The latest technology like IVF and intracytoplasmic sperm injection have made it possible for those couples to conceive. First of all, before starting the IVF, it is very important to do certain investigations and a thorough pelvic and systemic examination of both the partners. Any systemic disease like diabetes, thyroid, any family history of congenital abnormalities of the baby, genetic disorders, or any other problem should be thoroughly mentioned. All the blood tests to see the hormones are balanced should be done beforehand only. Vitamin D, any local infection should be treated. So, the first step in starting the IVF is to stimulate the ovaries. Normally, the ovary produces single egg on either side in a normal menstrual cycle, but we aim to produce at least 15 eggs to give good results. So the ovaries are stimulated with the help of hormones. These hormones are given subcutaneously or intramuscularly every day for 9 to 10 days. Once the follicle mature, then these are retrieved. In between, at least 4 to 5 times ultrasound examination, that is called a follicular monitoring, is done, and 2 to 3 times blood test is also done to see the progress. Second step is retrieval of eggs from ovaries. The eggs are retrieved with the help of ultrasound. There is a small needle attached to the ultrasound probe which is introduced in the vagina, and eggs are retrieved from both the ovaries under mild general anesthesia. The anesthesia is given only for 10 minutes and all the eggs from both the ovaries which are there are removed. It doesn't mean that the ovary finishes off all the eggs. It's only at that time whatever are the number of eggs present and have matured are retrieved. These are placed in a plate and kept in the incubator. The second step is to collect the semen sample. The male partner is asked to collect the semen sample in a sterile container, which is again kept in the incubator. The third process is fertilization. These eggs which are removed from the ovaries are fertilized with the help of IVF or intracytoplasmic sperm injection. After fertilization is done by the embryologist, the next step is to culture these fertilized eggs and make embryos out of these. Again, after fertilization, the dish is kept in the incubator. Incubator acts like an artificial uterus, so the temperature, pH, everything is maintained in the incubator. The next step is to watch for development of these embryos. This is job of an embryologist. She keeps watching the embryos from day 2, day 3 and day 5. Day 5 embryos are called blastocyst. So depending on the development and the growth of these embryos, the day of transfer is decided. The next step is embryo transfer. Embryo transfer is a very simple process. It is not done under anesthesia. It is something which resembles IUI. A very small catheter is introduced into the uterus. This catheter is loaded with embryos, and with the help of ultrasound from abdomen, these embryos are placed in the center of the uterine cavity. Now, whether the implantation takes place or not, whether these embryos stick to the uterus or not, is not known. After the implantation, patient is given some hormones, progesterone hormone, so that it supports the pregnancy. The best part is when the result comes. It generally comes on 9th day in the case of blastocyst, 12th day in cases of day 3 embryo transfer, and on 14th day, day 2. So after the result, the most exciting part for an IVF specialist is to give good news that the couple, the female, has conceived, and we are quite excited to give this news. So IVF is not a very tedious process. It can be done in the outdoor. Only the admission is needed for 4 to 5 hours on the day of egg collection, when the eggs are retrieved from the ovaries. There is no need for complete bed rest even after embryo transfer. Patient can take a day rest after that if she desires, but it is not compulsory. So, any problem, if you feel that you are not able to conceive and doctor has advised you to go for an IVF, that is a simple process. Don't get scared and go for it. All the best. Thank you.